I think there's a lot of advantages of having a healthcare practitioner in the facility. Certainly that's where the model's going in the past several years with nurse practitioners and physician's assistants. I think a physician provides a lot of the same sort of benefits to a facility. Patients will be able to see sooner. We had spoken about a lot of times we have a very sick patient who comes in. The greatest risk of them having to go back in the hospital is within the first 7 days. So you really want them to be seen by the most experienced staff as soon as possible. So if you have a physician seeing people earlier, you're able to start therapy sooner, make sure labs are ordered, make sure there's a very careful medication reconciliation. Speaking about medication reconciliation, everybody realizes that is a big potential problem, that a lot of errors made. A lot of the issue is lack of time. So having a healthcare practitioner in the facility takes the time that it needs. You know, many doctors take only a couple minutes to do med reconciliation. You can use 10, 15, 20 minutes to really carefully look through this. You have the time to communicate with the providers who took care of the patients from the hospital, as a hospital admission, or from another facility. All these things take a lot of time. If you want to set an example of good care in the facility, educate the staff, develop processes, go to meetings that are productive meetings that, accomplish things, collect data, analyze the data, not just have meetings for meetings' sakes, but meetings that actually accomplish things. There are going to be a lot of things that physicians can do. A lot of these things I talked about are what medical directors and attendings do anyway, but you're talking about somebody who's committed to this. And through AMDA, they're talking about things having a nursing home specialty. And I think that's a lot of defining, what do you need to know and how do you use these characters to provide better care in facilities. So I think there's just numerous reasons for them. I mean, there are barriers also, compensation, time, that sort of thing. But I think a lot of the similar characteristics for nurse practitioners apply to physicians because patients are a lot sicker. Everybody knows this in the nursing homes, and we can provide greater care, but if you want to do it the best way, you want to provide good oversight also. I think that if you look at the issue of transitions of care, firstly and foremost, I think you need a champion for that. Now, it could be anybody in the facility, but let's be honest, it's probably most natural for a physician to be that champion, because not only do you have to set up your process in the nursing home with, medication reconciliation, talk to the family, setting expectations, that sort of thing, but you want somebody who can communicate to the other physicians, so you want to have staff meetings, and can speak to the hospital too. Somebody who's going to talk to the emergency room, talk to the EMS squad, talk to the hospital administrator. Who's going to run these things? Who's the leader? And I think if you're looking at the physician as a leader, still as part of the interdisciplinary team, but working with that, I think it has to be a lot of different aspects, but I think it's a natural position for a physician leader to do this.